Good afternoon, Keith Tebow with you again here on FRCMedia. As you know, we'd like to get you as much information as possible in terms of the status health-wise of our community facing the pandemic and COVID-19. So thought I'd bring in someone we spoke to a little bit earlier, I believe it was earlier in the fall. Pleased to be joined by the Chief Medical Officer at the HealthFirst Family Care Center in Fall River, Dr. Eric Vaught. Dr. Vaught, how are you today? Thank you for joining me.
Yeah, thank you for having me on. It's a pleasure to be able to speak with you and to your audience.
Thank you for joining us. You're in the front lines of still what's happening within the city. The COVID numbers and the infections have been extremely high and steady for quite a while, especially since the holiday season. From your perspective there at Health First, right in Fall River on Quarry Street, what are you seeing in terms of infections, at least from your point of view, in terms of city infections? Are they improving? Have they been holding steady?
Yeah, that's a great question. So the community health center here at Health First, we serve a very representative portion of our community here in Fall River, and so we are still seeing a positivity rate that continues to actually climb, and we expected that coming out of the Christmas holiday season. Last week, Fall River reported over 150 cases per 100,000, which is the highest on record. And so we continue to see those patients in our facility. We continue to test those patients. We continue to offer testing in the parking lot to our patients. Even as we start to roll out the vaccine, we're continuing to see those rise in COVID cases.
Something that I found interesting, I just read about today, is that, even though the number of COVID cases has been on the rise, the seasonal flu has actually not been as severe as in the past. That could be, I guess, because people are wearing masks and being socially distanced, and it's not as heavily contagious as COVID. Are you seeing that as well?
Absolutely. I wouldn't say that flu is non-existent, but boy,
Right.
when we started this pandemic, we talked about flattening the curve, and the influenza season of 2021 looks to be the lowest on historical record, and that has a lot to do with the public health measures that we've put in place for COVID. And so, yes, we're seeing very, very low numbers. We saw a large number of folks be vaccinated for influenza after the state mandated that all school children be vaccinated. We saw a large uptick there. We also saw just community members realizing that the influenza vaccine was just one more way that they could protect themselves during this season. And what that does is it really helps the medical providers when they go in and evaluate someone who has viral illness symptoms to really differentiate that it's most likely not influenza and more likely to be COVID. And it really helps with the diagnostic picture.
Getting back to COVID now, are you anticipating that the rollout of the vaccine, and I want to get into that in a moment, but as more people get vaccinated, we will hopefully see the numbers decline. But are you also hopeful that now that we're over the holidays, when a lot of people were together, that community spread is maybe a little more limited than it was toward the end of the year, that possibly the COVID numbers, infections will begin to drop in terms of the instances as we head toward the period when more people will get vaccinated?
Yeah, so a couple of questions kind of in that that we're watching very, very closely. So the first is that the COVID vaccine itself, and this was a key point that I think that your audience and the greater community really needs to understand is that we're vaccinating individuals in order to prevent the development of severe disease requiring hospitalization. That's how it got the FDA emergency use authorization. And so there's still an unknown about whether or not someone who's been vaccinated could contract the disease and therefore transmit it to others. And we'll continue to get more and more data about that in the coming weeks. But that will be one of those things that maybe we've decreased the number of hospitalizations or people requiring mechanical ventilation in an ICU, but that we're still seeing a large proportion of the population infected with the disease. So we'll have to watch that over the next couple of weeks. But to further answer your question about do we see that the numbers will stabilize, we have seen the number of hospitalizations begin to decrease since the last couple of weeks of December. And so what we would anticipate is that as we get further and further out from the holiday season, that we would see the COVID diagnoses come back to some pre-holiday level.
All right, I want to get into the vaccines now. As you know, the vaccine has begun to roll out through the phases. The governor has announced, and the Department of Public Health in Massachusetts has announced 3 phases in terms of when people can expect rather to receive the vaccine. We're still in phase 1. We'll be in phase 1, I believe, into February. In terms of what you see about the vaccine, let me just ask you: do you feel that the vaccine will be safe, and are you recommending to your patients that they do take advantage of it if they're able to?
Yeah, so I myself got vaccinated back on the 23rd of December with my first dose of the Moderna vaccine. I'm scheduled this Friday to get the second dose in that vaccine series. And to back up just a little bit on your question, so the FDA approved at this point 2 different vaccines. One is the Pfizer vaccine, the other is the Moderna vaccine. Due to some of the storage and handling requirements for the Pfizer vaccine, that is being distributed through the hospitals that have the deep freezers to be able to store the vaccine appropriately. The clinics like the HealthFirst Community Health Center here in Fall River, we've been allotted the Moderna vaccine due to it not requiring the extreme cold temperatures in storage. And so since December, we have distributed 200 vaccines to our staff, both the COVID facing and some of the support staff here at the health center. We've also, in partnership with the Fall River Public Health Department, we've reached out to the first responders and some of the other entities within phase 1 of the governor's plan for the COVID vaccine rollout. And then this week, we have started to vaccinate the congregate settings that are here in our community. And so in alignment with all of the guidance that's been put out by the Massachusetts Department of Health, we continue to vaccinate those groups in our community. And we anticipate, as you pointed out, moving to phase 2 and our patient population around the second week of February.
And there's still a lot to be determined in terms of the distribution of the vaccine. A lot of people are very anxious about it in terms of they want to get in line, they're ready to go, they're ready to get their first dose of the vaccine, and if need be, a second dose, depending on the version of the vaccine. There may be a vaccine that may come out that may only require 1 dose. We'll wait to see if that comes to be. But in terms of the process, people, I guess, have to remain patient. And do you expect at some point that HealthFirst will be a vaccination point for the general public to get a vaccine when the time comes?
Absolutely. And I would just applaud the Massachusetts Department of Health, our own Fall River Public Health Department, that they have done a very good job of systematically identifying those groups in phase 1 and then in phase 2 and 3, respectively. And one of the things that we see as we look at other states across the United States is that Massachusetts has clearly identified those groups and then has week by week systematically gone through and we've been able to vaccinate those groups as identified. And so, yes, I agree with you that I would ask our patients and our community members to be patient with us as we walk through these phases and do this in a very organized and controlled format. I do see HealthFirst being a community partner where people in the community can come and be vaccinated. I know that there are multiple entities across Fall River that are being set up to be sites where vaccinations can be obtained when appropriate. And I would just to get to your question that you asked before, I would advocate for all community members to be vaccinated with either the Pfizer or the Moderna vaccine. Both have been shown to be very safe in their use. We've been following the adverse effects data that continues to come out very closely. The most common side effect being localized redness and arm pain at the injection site. There's about 10% of the population that will develop flu-like symptoms, the fatigue, the body aches, the headaches, or even a fever post-vaccination. Those folks we watch very closely. Here at our own health center, we had staff members who received the vaccine that had some of those side effects, and we were able to watch them closely and monitor for further symptoms. The same thing would be expected as we roll this vaccine out to the general population.
All right, Dr. Eric Vaught, as always, thank you for joining us. Thank you for the update. It's good to get updated on what's happening at HealthFirst. And, as more information becomes available, as the new administration rolls out its plan for vaccinations, I'm sure a lot of what some people may be a little confused about in terms of when do I go and where do I go, hopefully that'll all be worked out with the help of many partners, including HealthFirst. So, Dr. Vaught, thank you for joining me again, and we'll talk soon. I appreciate it.
Absolutely.
All right. And thank you for joining us today here in FRC Media. I'm Keith Tebow. Have a great day.